today's press conference. If you need access to record or would like to ask a question, please indicate so in the chat. We will limit questions to one per outlet today, and we are limited to 30 minutes. If there are remaining questions in the queue when we conclude and you feel your question hasn't been answered, please submit your questions in the chat or by email, and we will work to get you a response in writing. We'll begin in just a few moments after we grant recording permissions. Okay, I believe all permissions for recording have been granted, and if you requested permissions in the chat, you should now be able to record. If you still need permissions granted, please leave us another message in the chat. Dr. Vanderhoff, we will turn it over to you to begin today's press conference.
Well, good morning, and thank you for joining us today. I'm Bruce Vanderhoff, Director of the Ohio Department of Health. Well, the good news is that the level of COVID-19 virus circulating in our communities has continued to decline significantly. Case counts have dropped nearly 30% in Ohio over the past 2 weeks, although we recognize that with the popularity of at-home testing, many cases may go unreported. A more accurate picture may come from the level of severe disease we see in our communities, as reflected in hospitalizations, which have also declined about 25% over the past 2 months. It's sobering to realize, though, that despite these positive indicators, about a dozen Ohioans continue to die of COVID-19 every day. We recently passed the unfortunate milestone of 40,000 deaths in Ohio. And as we've mentioned previously, this virus has proven its ability to mutate, and new variants of concern have emerged about every 90 to 120 days to impact us throughout this pandemic. Now, that pattern appears to be continuing globally. Several new Omicron subvariants have recently appeared, including BQ.1.1 in Europe and XBB in China. And although those variants are currently at low levels in the United States, it's reasonable to expect that as we head into the colder months, we could see them driving another wave. Now, this could coincide with the holiday season and the opportunity for larger indoor gatherings, whether it be for Halloween costume parties or Thanksgiving dinner or December holiday parties and get-togethers. With so many Ohioans now either vaccinated or having acquired some natural immunity from a previous COVID infection, or both, we have much more protection from B and T cell immunity than we did this time last year. But remember, even a very mild case of COVID causes disruption in our daily lives and places more vulnerable people among us at risk for more serious illness and death. So my message today is that we have tools at our disposal that we know can help us avoid these disruptions and serious risks from COVID. Very simply put, those tools are prevention, testing, and treatment. Now, prevention, of course, starts with vaccination. It remains true that the single most important step you can take to protect yourself is to be up to date with your vaccinations. The CDC considers you up to date if you've completed a primary series and received the most recent booster dose recommended for you. The updated fall boosters now allow booster shots to specifically target the Omicron variants. They are widely available, and last week, federal agencies approved their use for those as young as age 5. What's important to know is that the emerging variants I mentioned earlier, BQ.1.1 and XBB, have shown some ability to evade antibodies, which are the immune system's front line of defense. And this may mean these variants will be able to make more of us sick, even though we may have been vaccinated and/or had previous illness. But there is, as of yet, no indication that these variants can break through our B and T cell immunity to cause severe disease. Vaccinations and boosters are a very effective way to build that highly protective B and T cell immunity that is so important in preventing hospitalization and death from COVID-19. So my message is that if you are not vaccinated or boosted, now is the time, as you can acquire significant protection before these new variants become widespread. There are other ways, though, that you can help prevent contracting this virus. Masking may be appropriate in certain situations, such as on public transit or in healthcare settings. Taking steps to improve ventilation in your home, your school, your business can also be effective. And of course, we need to remember the fundamental advice we all received growing up. Stay home and away from others when you feel sick. The next tool in our toolkit is testing. And it's important to have a plan in place if you or someone in your household develops symptoms that could be COVID-19 or believes they may have been exposed to the virus. Prepare for that by either having at-home tests available or by knowing how to get tested quickly. Time is important because if you test positive, you need to isolate and protect others from the virus. It could also be crucial if your healthcare provider determines that you would benefit from a therapeutic treatment, some of which are only effective in the first few days after symptoms develop. Tests are widely available for purchase at retail outlets, and many insurance plans now cover the cost. In addition, the Ohio Department of Health continues to send limited numbers of free tests to our community partners, which include libraries, community centers, and local health departments. And as I just mentioned, it's important to follow CDC guidelines if you test positive. And that means staying home and isolating from others in your home. Wear a mask if you just can't avoid being around others. If you have no symptoms, isolation can end after 5 days, but we'd encourage you to wear a mask for another 5 days after that. Likewise, if your symptoms are mild, isolation can end after 5 days, provided you've been fever-free for 24 hours without using fever-reducing medication. Of course, if you're in a higher risk category or have more severe illness, your first step should be to contact a healthcare provider. I just mentioned therapeutic treatments. These are very important considerations, especially for those at higher risk for severe illness. So if you're in a high risk category and develop COVID-19 symptoms, contact a healthcare provider right away because time matters and a prescription is required for these treatments. Now, to learn more about these treatments, I want to turn to our guest today, who's Dr. Stephen Gordon, chairman of the Department of Infectious Disease at the Cleveland Clinic. Good morning, Dr. Gordon, and thanks for joining us.
Oh, thanks, Dr. Vanderhoff. It's a pleasure to be here.
So when people come down with COVID-19, what are their therapeutic options? And how do the supplies of those look right now?
Well, thanks for the question. We are in a much better place, I think, both in terms of options and access. So right now, all available treatments are an adequate supply for the demand that we're seeing. And as you mentioned, Bruce, that fortunately, the numbers of severe cases and the numbers of transmissions are moving down, but there's still a lot of virus out there. I think our last week at the clinic, it's about a 9% positivity rate, which is better than it was, but it's not as if there's none. And I like your points in terms of this is almost a shared decision-making process. So with the availability of home testing, which is a fantastic thing, we're empowering our patients, to probably call me with the test and with the symptoms. And that would allow me then to execute after a discussion on prescribing what we would say are oral antivirals, which are now the drug of choice for people that are infected, but not severely ill, but are at risk for potentially, as you said, developing symptoms. And a lot of that is driven for some factors that we don't control, such as elderly age, or for other comorbid conditions that we might have, whether it's obesity or hypertension. And then, of course, you mentioned the vaccine status, but also immunosuppression. So other medications that may be given to treat other conditions, but would affect vaccine response and immune response to infection.
Yeah, thank you. In addition to these treatments, we also have another important medication currently available, Evusheld. And it, for some patients, is certainly going to play an important preventative role, at least for the present. So for now, who is Evusheld really an appropriate preventative for?
Well, thanks for the query. And as you know and have you mentioned, Evusheld is 2 injections given intramuscularly. And it is, again, a protective monoclonal antibody, which provides another defense in patients who may be at risk for not mounting a great immune response. It is not a substitute for vaccination, which I think it's important to know. And it's also not used for treatment. So you need a negative test to get this. And we have patients, obviously a lot of patients that are transplant recipients on a lot of immunosuppressions, including biologics or high dose steroids. And these are the patients in which Evusheld we're educating and delivering. And the good news is right now for the circulating variants, it still remains protective activity. And now we have patients, quite frankly, that have gotten more than 1 dose. It's given every 6 months cadence. But as you mentioned, the threat or the looming threat might be what we now call these grandchildren variants of Omicron. And you mentioned a couple of them, which again have mutations along a certain spike protein, which in the test tube looks like render the effect of Evusheld minimal. And so could render that useless if we have widespread outbreak in these patients before they get this medication. So that's the important thing. It's a dynamic situation. I think we're all used to that. It's hard to telescope or forecast, but as you're emphasizing, it is about mitigation of risk and doing those things we can do right now with the tools we have now to prevent severe disease, death.
Yeah, thanks for that. Unfortunately, a number of surveys have recently indicated that despite these treatments having been available now for quite a while, too many people still are not fully aware of them. Have you seen that problem, and what efforts can community leaders and healthcare practitioners take to make sure that their patients and their community are better informed, better aware of treatments and their availability?
It's an excellent question. And as you also mentioned, it is also linked to testing. So the whole principle that you emphasize of test to treat, not just test to know that you're positive, because most patients with positive tests are not going to be candidates or need treatment. But it is that subset of population, which is still significant, although not the majority. And as you also mentioned, Bruce, time is of the essence. It's 5 days from onset of symptoms for either the monoclonal antibody infusion or the Paxlovid. So this is where I do think we need probably better outreach as well as better education in a peer-to-peer fashion and testimonials from patients who have received this, who have done well with this. It's hard to measure what you prevented. We understand that as well, but not to get what we would say COVID fatigue, because we would hate to miss the opportunity to mitigate hospitalization or a severe outcome if it could have been potentially intervened on.
Yeah, and finally, Dr. Gordon, one of the things you touched on was that there is some concern that some of these emerging variants could have an impact on the effectiveness of some of our treatments. If these become the dominant variants, and that's true, how should people think about treatments? Are there still other options that their provider might want them to be considering?
It's another great question, and it is dynamic. But for some of the variants that you mentioned, it still looks like at least things like remdesivir, things like Paxlovid would still be effective, as well as the betalimumab. These are drugs we give or therapies we give to people that are infected. But as we've learned, this is not going to be a one and done. Some people have made now, is this analogous to influenza, where you're seeing now more than one strain in a vaccine? Are we also seeing the issues of likely even more variants that may be put into the vaccines? I think before we get there, however, it is important to understand coronavirus is not declared a seasonality like influenza. We have time with flu, usually the austral strains, to develop and to get them into vaccines. And that, as you mentioned earlier, the cadence for the VOCs is not that way. And we don't know what will happen. And that's the importance, as you've also inferred, of continued what we'd say genomic surveillance, continued wastewater surveillance, as well as hospitalizations, as well as new drug development. Ideally, what is now talked about, and I know you mentioned this before, is a pan-coronavirus vaccine, similar to what we've talked about, a pan-influenza vaccine. But that's probably easier said than done. And so in the meantime, let's, as you said, increase the opportunity for your broad, what we'd say, immune response to the bivalent vaccine that we have now, as well as do the other things that you've emphasized in terms of prevention as we head into respiratory season, which includes influenza, RSV, other coronaviruses, and including the SARS-CoV-2 as well.
Thank you so much, Dr. Gordon. Well, before we wrap up today, I want to talk about another reason why being up to date with your vaccines is very important. It didn't take long into the COVID-19 pandemic for us to begin hearing reports from people who had lingering COVID symptoms even after their initial infection had resolved. The most common reported symptoms are shortness of breath, chest discomfort, fatigue, and what's referred to as brain fog, a general sense of confusion, forgetfulness, or lack of focus. Other people have reported experiencing dizziness, stomach issues, joint pain, even low or high blood pressure, or a persistently fast heart rate. Some of these symptoms have gone beyond minor annoyances for people and have affected their quality of life for months or even a year or more after their initial COVID recovery. The bundle of symptoms has now become known as long COVID, and it's being taken very seriously by the medical community. In June, the CDC estimated that about 1 out of 5 adults who were infected with the COVID-19 virus have suffered from long COVID. Some estimates are as high as 1 in 3. That adds up to millions of Americans and certainly many thousands of Ohioans. What I want to really emphasize here, though, is that the numerous studies that we have suggest that those who were unvaccinated were more likely to experience long COVID than those who were vaccinated and completed that primary series. So again, vaccination appears to offer protective benefits for you, not only from severe illness now, but perhaps also from potentially debilitating symptoms later. I'd also like to remind people about the importance of getting a flu shot this year. And Dr. Gordon referenced this. As I've previously said, there is concern about a resurgence of influenza this season after 2 years of lower than usual numbers. That was probably attributable to all the other changes that were going on as part of our response to the COVID-19 pandemic. And I can assure you that it is safe to get your flu shot and your COVID vaccine or booster shot at the same visit. Now, we've been talking for some time about COVID becoming part of our healthcare landscape like flu. And again, Dr. Gordon was pointing to that or referencing that. About this transitioning from something that we think of as a pandemic to another of our endemic illnesses, one we must learn to manage and live with for the long term. Part of making that transition is to follow the outline that I discussed today, using the tools of prevention with an emphasis on prevention that includes vaccination and boosters, on testing and treatments. If we do this, my hope is that we can all enjoy the upcoming holiday season free from disruption, that we can stay healthy, gather together safely with family and friends. Thank you. And now, Ken, I think we could open up to media questions.
Thank you, Dr. Vanderhoff. Our first question today is from Joe Ingalls, Ohio Public Radio and TV.
Thank you, doctors, for taking my question. I want to ask you about these new variants that we're seeing in other countries, Europe and China. The variants, from what I'm reading, they are Omicron variants, but there is some question out there as to how much protection the current bivalent vaccinations actually give on these variants. Is there anything that suggests that if you get these bivalent Omicron boosters that you are more protected against those variants?
Yeah, thanks. Great question. I'll open up and then I'll turn to Dr. Gordon, who's an infectious disease expert. First, one of the things that we need to recognize is that our vaccines continue to demonstrate very strong ability to protect us from COVID-19 and thus far the many subvariants that we've seen, the children and grandchildren of Omicron. And that's really important. And that's why I was pointing to the fact that our vaccines, yes, prompt initially a phase where we have an increase in antibodies that are targeting the virus, but more importantly, appear to stand up for us very strong, what we've called cellular immunity. It's the B and T cells of our immune system. It trains them, helps them to recognize the virus and respond very vigorously. And the mutations that we've observed with these two new variants that do seem to have some ability, we haven't fully characterized it yet, some ability to evade that antibody part of the immune response, really have not demonstrated thus far indications that they are substantially avoiding that cellular immunity, that B and T cell immunity that's so important in preventing us from getting really, really sick. Now, we're going to have to watch because they're new variants. But I think broadly in the medical community, we maintain a lot of confidence in the ability of our vaccines to offer us protection. Dr. Gordon, this is your area of expertise, so I'll turn it to you now.
No, I think it's a great question. And again, as you point out, we're always going to be probably a variant behind in terms of vaccine production. The good news about the mRNA platform, of course, is that it can be changed as we've seen. And currently there's a good match. But Ms. Ingalls, your question is a good one. And we will have some boots on the ground data in terms of when we look at the UK or India where these places are. But there were some, I think, some early data presented by the companies today on the bivalent, which looked very promising at the ID meetings this week, that again, the ancestral strain with the bivalent is providing some help, some what we'd say broad band protection against these grandchildren, quote unquote, variants of Omicron. And remember too, it is not so much about infection as much about severe disease and deaths. That is really the goal here in terms of our platforms.
Okay, our next question is from Jackie Orozco, ABC6 Fox 28.
Yes.
You there, Jackie?
Yes, can you hear me?
Yes, go ahead.
Okay, sorry, I was having some computer issues. One of my questions is, because we keep talking about these new variants and then new and updated boosters and immunizations, a lot of our viewers are just wondering, I mean, how many shots do we need to take? Is it always a new shot that's available for every 6 months, every year? It just seems never ending.
Yeah, that's a very good question. I think it's one that's on many people's minds. My answer to that would be we don't know at this point what the cadence of vaccination is going to need to look like. And we are continuing to learn as the virus evolves, and we see how our immune systems are responding to the evolving virus. What we can tell you is that we've got very good tools for today. And rest assured, there is a tremendous amount of scientific research and study looking at this. And I'm confident as we head into the future, those answers will become clearer and clearer. Dr. Gordon?
Yeah, Ms. Rusko, another great question. In talking to the companies, and the ideal is to try to get it to once, for the booster, once a year. And as we said, we're not certain that will happen, but that's the goal. And most likely at least targeting those at highest risk. And so it is analogous somewhat to influenza now in the elderly. And when we look at uptake in vaccine rates, it's usually the elderly that have the highest uptake in terms of influenza. So I think as I said, the seasonality is an issue in the variants, but I think the goals for most of the vaccine companies are to make it an annual event, so to speak, as opposed to more than that.
Hey, our next question is from Laura Hancock of Cleveland.com and the Cleveland Plain Dealer.
Switching gears on illnesses, I have a question about monkeypox. At this point in Ohio, and I think in the United States, we're still seeing it. It hasn't spread to the general public yet. It's still, basically in the LGBTQ community. And so I was just wondering if you could talk about that. Do we expect it to? Is it just going slower than initially thought? Like, do we expect it to go into the general public? Is this going to become a fast moving thing? Like COVID seemed like pretty fast moving. Is this going to be the same?
Well, I'll begin. It was, I think, our hope in public health really from the first cases that were reaching the United States, that we would be able to intervene and work with people in such a way that we mitigated against the risk that this would become more widespread or a growing problem in the country. And we've done that through a combination of very active engagement with people around prevention and understanding the risks of acquiring monkeypox, as well as vaccination. And I think that that dual effort has really worked very, very well. As we look at the cases of monkeypox, both here in Ohio and across the country, we are now on a downward slope in terms of case numbers, et cetera. Now, I am quick to say that we are not done, and I don't want people to think we are out of the woods, but I think that we can look at the interventions that are currently underway and feel very confident that they are working, but we need to remain vigilant and continue to engage in both reduction of risk along with vaccination, especially for individuals who may be at higher risk of acquiring monkeypox. Dr. Gordon, again, as an infectious disease expert, this is in your wheelhouse. Anything you'd add?
No, thank you. I think, again, this was another stress test for public health and for the clinicians. It's not a new disease, but this variant was a new presentation. And again, the close contact transmissions in targeted groups initially were quite pronounced and provided opportunities and challenges to reach out to the groups. The difference, I think, with SARS-CoV-2, of course, is one, we did have a vaccine already effective, the Jynneos vaccine. And as you know, the FDA quickly did a dose-sparing regimen to extend these two-dose regimen, which does appear to be effective in terms of mitigation. The second, of course, was education and peer-to-peer. In some of the studies from CDC did show there were changes in risk behaviors amongst a lot of groups in terms of unprotected intercourse, number of new partners, which is also extremely important. Having said that, anyone can get monkeypox, and we have seen cases in in non-LTGB, men who have sex with men, in severe cases are still present in hospitalized in our system and others. And so I don't think we're done with this yet, but I do think there's a lot to learn, and also that this vaccine will become, I would say, more indicated in more populations once the dust has settled, again, for mitigation for potential future spread of this strain or other strains that may be imported.
Our next question comes from Tom Jackson of the Sandusky Register.
Dr. Vanderhoff, as you mentioned earlier, there seems to be a lot of evidence that quite a few people are dying needlessly because they're not getting the available treatments for COVID-19. Do you have any sense on whether Ohio is doing better or worse than the U.S. as a whole in persuading people to get treatments? And what is the health department doing to promote these treatments in addition to this press conference?
Yeah, thank you. So, of course, we see treatment along with testing and prevention, especially vaccination, as all very important legs on the stool of our response to the COVID-19 pandemic. You know, in terms of treatment, we have been working very, very actively for quite a long while with both healthcare providers and local health departments to get messaging out to people, knowledge out to people as broadly as possible. And we're going to continue with those efforts. Some of those include messaging that we convey through more traditional channels, some even though through some of the more modern channels that the people younger than me use on their cell phones. But the bottom line is we have these treatments. They are well available in the state. They do require that you have a consultation with a healthcare provider. And that's why our message is, if you are worried about your COVID-19, you have you know yourself to be in a high-risk category, you know yourself to have underlying conditions, you're you're at greater risk for becoming seriously ill from COVID-19, please contact your provider as soon as possible. And we'll continue to cascade that message, but we are seeking your help also in getting that message out to the public.
Okay, our next question comes from Jim Provence of the Toledo Blade.
Hi, Dr. Vanderhoff. It's been a while. We're less than 3 weeks away now from the election, and well, I know we're a long way from where we were in the primary of 2020 when the primary was postponed. But do you have advice for voters who may find themselves standing in line on election day or maybe even before?
Yes. So, you know, all the messages that we've shared today would be my messages to people who are either going to vote or who are, you know, thinking about the seasonal activities of the fall and early winter, parties and other gatherings. We have the tools. It's important for us to use them. And so they certainly include all the preventative tools that I've discussed, especially vaccination. If you're not up to date with your vaccine, if you have not received your booster, get out and get that taken care of. They include masking, considering your ventilation situation that you're going to be in. There is nothing wrong with putting on a N95 mask to go and vote if you're worried about your exposure. It's okay, you're allowed to do that. But there's also another piece to that, and that is, if you're feeling ill, you really owe it to yourself and others to not expose them. Now, you know, that can be a little bit of a challenge if the day you come down with illness is election day. But Dr. Gordon?
I have little to add. I think that that's spot on. This is an individual choice. I think that, the mask mandates are long done. But again, respiratory season, influenza, and you should not feel stigmatized, as Dr. Vanderhoff said, in any place where you're going to be where you feel more comfortable in wearing a mask. And then, of course, we still have in Ohio the option to, I think, have absentee ballots or voting early, which would be two other ways to mitigate crowding if that's a concern. And you already know whom you want to vote for.
Okay, our final question today comes from Destiny Davis of WBNS 10 TV.
Hello. I just wanted to switch gears and kind of talk about RSV for a second. I'm wondering if parents should be worried right now. Nationwide, Children's has been reporting an increase in cases and seeing those people having RSV in their emergency departments. So what can we do to protect, younger Ohioans? And like I said, should parents be worried?
Well, I think that the medical community broadly is very concerned, looking at the experience that the southern half of the globe had. Remember, their seasons are opposite to ours. They just came out of their fall winter time period, which is the peak of respiratory season, and they had a very severe respiratory season. So many of the respiratory viruses, including influenza, RSV, para-influenza virus, etc., really occurred in very, very high numbers. So I think as we're heading into our respiratory season, these messages around common sense, practical steps to reduce exposure and transmission of respiratory illnesses are ones we all need to take to heart, as well as remembering the importance of vaccinations that we do have available to us to reduce some of our risk around these respiratory viruses. Some we don't have vaccines for, but we certainly do for influenza and COVID-19. Dr. Gordon, anything that you'd add?
No, it's a great question. We are in RSV season. It is probably our most common respiratory isolate that we're seeing in our patients less than 5. And again, it's a droplet contact as opposed to the airborne, but nonetheless, in certain kids, as you know, it can cause severe breathing issues, especially with underlying conditions. So again, all parents are vigilant, but it is a kind of this platform of respiratory protection as we move into cold and flu season.
Thank you.
Okay, we want to thank our guests today. And Dr. Vanderhoff, do you have any closing remarks?
Yes, thank you all for joining us. The important message that we are conveying today is as we're heading into the fall and winter, when we know that we are likely to see increases in a whole variety of respiratory viruses, we also know that we are likely heading into a time where particularly two vaccine preventable illnesses, influenza and COVID-19, are also going to be a part of the picture. And we strongly encourage people to consider their own vaccination history and get vaccinated or boosted as needed, as well as following good practical steps, including the advice that many of us received from our parents growing up, which is if you're feeling ill, it's best to stay home and avoid exposing other people until you're feeling better. Thank you.
Okay, this will conclude